Hi, I'm Dr. Amol Gupta, and I'd like to welcome you to our podcast, COVID Experts, Interviews with Top Physicians and Scientists. Through this podcast, we will share the latest clinical and research advancements across the globe to help you better understand the situation with coronavirus and what our future holds. If you have any questions or concerns, please do not hesitate to email us at info@covidexperts.org. Today we are speaking with Dr. Antonio Muñoz, an endocrinologist and the scientific director of the International Institute of Genetics of Diabetes in Spain. He recently published a paper in Clinical Infectious Diseases that evaluates the benefits of an independent activation of the non-classical Renin-Angiotensin system in diabetics at risk of infection from COVID-19. Let's listen.
My name is Antonio Luis Cuesta Muñoz, and I am endocrinologist, and I'm working at the Santa Elena Hospital in Torremolinos in Malaga, in Spain. And my focus is in diabetes, and also as a scientific director of the International Institute of Genetics, and also very involved in monogenic type of diabetes and metabolic syndrome.
How does an endocrinologist, metabolic syndrome expert like yourself, how did you get involved with the COVID epidemic?
I got involved in this because after reading a very nice manuscript published in the Clinical Infectious Diseases, I talked to my colleague, Dr. Luis Miguel Álvarez Aragón, about the high mortality in patients with cardiovascular disease. In this type of patient, in the knowledge of this type of patient, we thought about that very seriously. We realized that these patients, they are always living on what we call a chronic low-grade inflammation. Makes this patient more prone to the effect of the cytokine storm seen in these patients. And the core of the problem, we realized that the core of the problem was the lack of angiotensin converting enzyme 2 and the lack of the counter-regulation of the classical Renin-Angiotensin system.
The paper that you are talking of right now, what research paper have you written specifically in regards to the coronavirus?
We wrote a nice little brief report and letter to the editor, inquiring into the benefit of independent activation of non-classical renin-angiotensin system in the clinical prognosis and reduction of the COVID-19 mortality.
So can you explain for the audience the role of the renin-angiotensin system and COVID-19?
You have a classical system, the renin-angiotensin aldosterone system, with an end product, which is the angiotensin 2. Okay? And you have a counter-regulatory system, which is the non-classical renin-angiotensin system, which is again a counter-regulatory system of the classical RAS. And the end product is angiotensin 1,7. Which after binding to the MAS receptor presents important anti-inflammatory, anti-proliferative, anti-fibrotic, natriuretic, and vasodilator effects. Actions actually completely opposed to those promoted by the end product of the classical RAS angiotensin 2. There is a balance between both classical and non-classical renin-angiotensin system. And in this patient with COVID-1, there is no angiotensin 1,7, and there is no contra-regulatory system.
Let's start again with the pathogenesis of coronavirus.
The coronavirus needs ACE2 to be able to get, in this case, the alveolar cells. Once the coronavirus binds to ACE2, will lead to a downregulation of the ACE2 by the alveolar. cells, epithelial. And this low regulation of an expression of the ACE2 will lead to a pro-inflammatory state and profibrotic state.
If the downregulation of ACE2 is causing anti-inflammation, then that's good, right?
When you have not ACE2, you have an accumulation of angiotensin 2. And when you have a lot of angiotensin 2, you will have more inflammation and more fibrosis, because we need ACE2 to convert angiotensin 2 to angiotensin 1,7.
So when we talk about these anti-diabetic medications, the SGLT2 inhibitors, right? Mm-hmm. Have there been any studies that show that there's an increase in the angiotensin 1,7?
There is a studies done by NUDI, Society of Nephrology, in 2007, and also in 2017, where they do a study human renal cells treated with SGLT2 inhibitor, and they have found this increment in angiotensin 1,7.
Taking SGLT2 inhibitors, especially in a diabetic patient who is found to be at risk or has COVID, would be beneficial for that patient. Is that correct?
That is absolutely correct. That's what we are now studying, a very big cohort of patients.
We hear now with new research coming out that patients with metabolic syndrome, obesity, diabetes, yes, are at the highest risk for the COVID infection.
Indeed. They are not on high risk to get infected. No, everyone is the same. No, they have more risk to die. The mortality in this patient is much higher. Why? They have this chronic low inflammation state. They are more prone to the lack of counter-regulation of the classical renin-angiotensin system.
Absolutely. So have there been any other classes of anti-diabetic medications that may also have a similar effect of increasing angiotensin 1,7?
No, as far as I know.
So what would be the next steps for us to be able to better study whether or not the SGLT2 inhibitors may have a protective effect?
We have already started of a COVID positive patient in hospital and with severe disease, and patient that has not been hospitalized and with a very mild disease. We are also now seeing if those patients treated with SGLT2 inhibitor, they have now better clinical prognosis. That's the next step. We cannot do anything else now.
That's wonderful. Now, when we look at the SGLT2 inhibitors as a class of drugs, they cause a higher risk of side effects as compared to many of the other medications that are given to diabetic patients. Can you expand on that a bit and what the mechanism is of their side effects?
SGLT2 inhibitors have important side effects. They are not as common as we sometimes think, that the protection of the heart and the kidney is more important. It is more overt than the side effect that, personally speaking, at this point, I never have had in my patients.
Any other comments that you have for the people who would be listening to this?
The way we have been thinking. Sometimes we focus too much in the classical pathways and the classical pathologies, physiopathology of the diseases. And we don't see sometimes that they are around other pathways and other ways to tackle the disease.
Dr. Muñoz, this was very, very insightful. We may have somewhat of a promising drug, the SGLT2 inhibitors, which can increase the anti-inflammatory effects. So this was very, very helpful. Thank you so much for being on the podcast with us today.
It has been a pleasure, and I hope I have been of any help to my colleagues in the USA.
Thank you for listening to COVID Experts. Tune in for more conversations with some great minds on the subject. I'm Dr. Amol Gupta. See you next time.